That's not good. That is not... Oh! Hello again. We are going to go over a couple ethical issues here. First, we have a patient here. So, as nurses, each and every day, we are faced with decisions that we do have to make. I'm going to take this off now. Sorry. I have a cold. Didn't want to get the patient sick. But we are faced with issues that we face every single day that are ethical in nature. Some of them are to the extreme, as far as like abortion, or how we feel about that is the patient's rights. About beneficence and non-maleficence, and those kind of aspects, to the very minimal, or what may be considered minimal by some, as far as how you dole out breaks. Are there rewards in breaks and stuff like that? So it's just ethics play a part in every single day of every aspect of our lives as nurses, and especially if any of us move on to the role of nurse managers. So, right now we are going to go over an ethical dilemma with this patient right here. Yes. Note, I do not normally play with dolls, just so that we are clear on that. Yeah. Okay. So, this one is not so managerial, but it is an ethical dilemma still, in the sense that, we just really need to work through it to see whether or not the decision that is made is ethical. So, what we have here is a patient. Her name is Irma White. Hello, Irma White. She's an older patient, so she is just a little bit over 30. I'm kidding. Don't hit me, please. She's elderly, so she's like 85. She has come into the emergency room. She had respiratory distress. She has stated, it has not been stated though, that whether or not she's a full code or not, exactly what it is she is wanting. So the ethical dilemma is here because she does code. She does go down. And there is a practice that occurs among some emergency rooms, and even on med-surg floors and stuff, called the slow code, where basically full effort is not given into the code that is performed. So Irma goes down, and instead of the typical stay alive, stay alive, stay alive, we give a more slower kind of beat, like oh, I get a touch or a thrill out of you. Yeah, that's not appropriate, I don't think. And the depth isn't as far given. Full measures aren't given, as far as ACLS meds and stuff, that basically the code given isn't to the full extent. Now this is based on this decision that we are prolonging someone's life, that, Irma, she has chronic disease, her quality of life is already poor, so the decision is made by whomever it be, doctor, nurse, or otherwise, that we will perform a code, but not to the extent that we are giving it everything that we can got, to the fullest that we can give it, with in mind that we are actually doing it for the benefit of the patient, because otherwise they will end up with cracked ribs, their quality of life, if they do survive this code, the cardiac arrest or respiratory arrest, whatever it may be, that they will in fact be in greater pain, and overall what we are doing to them is actually causing harm rather than non-harm. So the decision has to be made, are slow codes ethically right? Is it okay for us to do that? As nurses, should we speak up to that, as far as, no matter the age, the chance of survival, the sanctity of life, and that's where ethical decisions come in. And that's kind of an extreme one, but it's out there. So that's something to think about and perhaps to talk about. So, okay. Let's move on to our next one.